Hi, everybody. My name is Camille Bell Jones, and I want to share with you my app, Nutrition by Condition. This app was built for people that have multiple chronic health conditions and are asking themselves the question on a regular basis, what can I eat? And so I want to show you what I have built to help solve that problem. When you sign up for Nutrition by Condition, it brings you to your dashboard. The first thing you want to do on the dashboard is set up your health profile. You tell it what conditions you have. In this case, kidney disease, gout, and diabetes. Stage 3B, kidney disease. You can also put in your labs if you want to. That helps you get more granular in what you can eat. I save my profile. And then once I save my profile, I can either get a list of things that I can eat, or I can search for specific foods. The first thing I want to do is just show me a list of what can I eat. There are 95 good choices, 342 okay occasionally choices, and 105 less recommended choices. I have categories of foods for each of the major areas. So if it's a good choice, here are your categories of food. Once you open up the categories, you can see that asparagus, even canned asparagus, is a good choice for your combination of chronic conditions. When I click on the food, it will give me a more expanded explanation of why this is a good food. Kidney disease, it's lower in potassium. For diabetes, it's very low in carbs. And for gout, it's low in purines. It tells you what you can do, include it regularly. You can save it to your list of favorites, and you can even add to your today's log of foods that you ate. You would need to tell it about how many grams or how much food that you ate, and you can add it. Okay, so now that you can see a list of things that you can eat, let me just show you let me go to less recommended. These are foods that are less recommended for my combination of medical conditions. Bamboo shoots. Well, why is it that bamboo shoots are less recommended? Let's see what the guidance says. They are less recommended mainly because they are high in potassium, which is an important limit to when you have chronic kidney disease. It goes on to talk about portions, the potassium concern, why this result. It breaks down for each condition. So those are things that are not good for you. If you wanted to, you could add it to your favorites, but it's not. It's less recommended. I'll say that. Even occasionally, these are things that are not necessarily that you can eat a lot of, but you can eat it if you have portion control. Let's go to the food search now. If I want to search for salmon for my condition, how does salmon rate? Same situation. If you want to search for foods, it's okay occasionally. My app also has a barcode scanner. You can scan it with your camera, or you can type in the barcode and it'll come up and give you the same kind of results that I give you for if you were to search for food. You can also do a plate analysis. You can use the camera, or you can upload a photo to see how that picture or that plate, things on your plate, align with what you can eat with your medical conditions, your health conditions. Right now, we only have 6 health conditions, but this is your food log that you ate for today. Here's your favorites. So that they are go-tos. So this is Nutrition by Condition, found at whatcanieat.app, and I am the founder, Camille Bell Jones, and I am proud of this app. If you want to know more about why I built this app, there's an about screen or page on the front. You can also play a game to see what your understanding is of nutrition and based on health conditions. I think people will be surprised about what they know and what they